Today we are joined by AUA Public Policy Chair Dr. Gonzalez. We are going to discuss some of the latest announcements for surgeons related to the coronavirus outbreak. Earlier this week, U.S. Surgeon General Jerome Adams suggested that Americans delay elective surgeries in the short term as the world grapples with COVID-19. The American College of Surgeons also made that recommendation. On March 18th, President Trump urged hospitals to postpone or cancel elective surgeries for patients. Dr. Gonzalez, with that in mind, can you please tell us what surgeons, specifically urologists, are seeing in the area of elective surgeries in light of the coronavirus concerns?
So we're seeing an incredibly rapidly evolving pattern here, and this is also unprecedented, and we don't really have a roadmap for this. So I think a lot of learning is being done on the job here. But really, what I'm telling you today is different than what I would have said 3 days ago. It's probably going to be different than what I'm going to be saying 3 days from now. So I think that the biggest thing right now is flexibility. And I also think the way to think about it is to think about what is urgent and emergent. And those are the words that are going around right now. Not so much what do I need to postpone, but what should we be doing? And there's a lot of reasons why that I can get into about that. So, I think when you're thinking about what should be postponed, what should be done, obviously I think we know the things like testis torsion, priapism, infected prosthetics, debridements and washouts, those need to be continued, and we need to have access to do those things. But in general, we want to think about what are our local conditions. So what's the blood supply like at our hospital? That's a rate limiting step for a lot of places. What are the resources? Where are the personnel going, or where are they needed? What's the physical protection for surgeons and for staff? What's the ventilator situation? So if we're going to be doing complex cases, what are the chances we're going to take up an ICU bed? And what's the ventilator capacity? What's the ventilator capacity of our system? I think it's very important to know those things. And if you're at a level 1 trauma center like we are here at Loyola, what does that mean for our trauma patients? And are we making room for those traumas that are going to be coming in? So these are all the factors I think that need to be taken into account from your local conditions. From the patient perspective, is your patient high risk? So do they have diabetes, hypertension, or immunocompromised? And really, I think those are the folks that if they are having what we would consider elective or non-essential procedures, I'll get into a little bit of what that means, then they really should be asked to wait. I think that it's not just a risk to them, but also a risk to the system and overburdening the system that's about soon to be overburdened. We also want to think about the disease process. So this is going to be surgeon discretion. So we've heard from the White House, we've heard from our local officials, we've also heard from our state officials. But really, at the end of the day, they're saying elective surgery, but per surgeon discretion. So this is where it really needs to come in, is can this surgery wait? Can it wait 2 months? Can it wait 3 months? Can it wait 2 weeks? Will it compromise the desired outcome that we want? Do you lose any window of opportunity for cure disease or disease control? These are the questions we need to think about. And cancer cases, especially high-risk ones, we just had a situation of what are we going to do about a tumor thrombus and a large renal mass? Those are tough decisions that we will let the surgeons involved and our specialists in those areas think about what the next step is. We're closely working with medical oncology for our high-risk bladder and kidney cancer cases.
Dr. Gonzalez, why is it such an important move to postpone these procedures, given the risk of infection and, of course, freeing up supplies and resources?
Well, as just mentioned, it's about capacity right now. So really what your local conditions are going to be to do elective surgery in these uncertain times right now when we're going to need the capacity elsewhere. We're already seeing a flood of patients at our hospital here at Loyola, as I'm sure everybody else is. And really, we've got the hospital broken up into COVID sections and non-COVID sections. So the thing is that do you want to expose your patient to that if it's a non-essential procedure that can wait? And the other question is are you taking up a valuable bed or a valuable ventilator for somebody who may need that very soon? And I think, as of today, I think the storm is pretty much coming upon us right now, and certainly more advanced in some parts of the country. But we certainly here in the middle part of the country are starting to feel this significantly.
What does this mean for urology practices who work in the ambulatory or outpatient setting?
So we're going to have a really rough road here going ahead. The question is how long until we get to the other side? And let me please emphasize that we will get to the other side. We will beat this, but the question is going to be how long is this going to take? And certainly all the things we're seeing in society right now with social distancing, we are hoping that it helps significantly. But really, we're going to have to hunker down and say that the resources are best to be spent elsewhere, and that we need to be prepared and discuss this and keep in constant contact with our patients that now might not be the right time for some particular procedures or some of the things that we do. They can wait. If it's not going to affect an outcome, if it's not going to compromise them from a cancer perspective, then these things should wait. And especially in the ambulatory outpatient settings, I think that really does ring true.
Dr. Gonzalez, if you have any other final thoughts or comments that our audience should know about at this time, please feel free to let us know now.
Well, I think just the message to everybody is just hang in there. We're going to get through this. Tough times ahead. There is no playbook for something like this, and I think we're learning quickly. We've got a lot of really smart people that are working on this and figuring out ways for vaccines and also potentially for cures. I think we just have to remain optimistic and do the best thing and keep in touch with our patients. Our patients have been incredibly gracious. They understand. They're willing to step aside and let the sicker patients go first. It's really what we're seeing is we're seeing the best of people right now, and it's very encouraging for all of us.
Dr. Chris Gonzalez is the AUA's Public Policy Chair. I also want to remind listeners for easy reference on AUA resources and other resources given the COVID-19 outbreak. Please visit auanet.org/COVID-19. That's auanet.org/COVID-19. Thank you again, Dr. Gonzalez.
Thank you.